Hey, it's Jessica Damaso with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today we're catching up with a good buddy of mine, Dr. Lyle Berkowitz. He is the founder and CEO of KeyCare, which is the first ever virtual care company built on Epic. Dr. Lyle, what is this all about? I mean, I know you guys launched back in August, but I'm excited to talk to you about it, hear about how things are going so far. So welcome to the show.
Thanks, Jessica. I'm happy to talk about it.
All right. So last I heard, you guys came out of stealth back in August. You came out with your Series A announcement, which I understand you guys have topped off on the A here in January of 2023. So now 27 million closes that round out for good, I think. But what I want to really get into here, Lyle, is like I've been trying to understand what you guys are doing at KeyCare and how this is different from all of the other myriad virtual care companies that are out there. Like, how are you guys doing virtual care infrastructure for health systems in a way that's different than Wheel or a way that's different from Amwell? So why don't you kick off the conversation there? Give us the pitch, talk to us about what you guys are doing at KeyCare that sets you apart as unique.
Sure. So first of all, what we do and what we're focused on is helping health systems by providing them access to a national network of virtual care providers, virtualists, working on our instance of Epic that's been optimized for virtual care. And when the health system has Epic and we have Epic, there's a lot of interoperability that essentially magically happens. Epic to Epic interoperability has been around for years for transferring data. But more recently, they've also created interoperability tools to allow for cross-instance scheduling, messaging orders, et cetera, so that we can truly support that health system. And some of the essence of why we're different and how we're different is that one, as a virtual care company, we didn't build brand new technology and try and compete with the billions of dollars that an Epic has spent on creating a meaningful use EMR. Most other the telehealth companies have built their proprietary technology, which a couple of years ago was the only ones that could do telehealth, and it was new, but they haven't really gone to the depth of a full EMR. Meanwhile, Epic is a fully robust EMR, has added on telehealth functionality to support video visits. They've always, of course, been able to do phone visits, and they've actually had e-visits available for like 15 years. So all that technology is available to us. And I can tell you how that plays out next to the health system, because there are four main benefits that result because of that.
All right, let's do that. Let's hear those four.
Let's do that. So one, patient experience. So when a patient comes to a health system and needs extra support, extra virtualist, urgent care, what we're starting with, they're able to go to the health system's front door. They can go through MyChart, their portal, they can go through the call center, and their patient's able to make an appointment with us as a partner to the health system, providers working on our KeyCare platform in a way that doesn't require them to leave Epic, doesn't require a new username or password, doesn't require them to re-input their medical information. So a really seamless experience for the patient. All the data is collected and shared. And that's number two, is the quality that becomes important when you share data. So the virtualists on our platform can see the patient's past data from their Epic sites and vice versa. As soon as they're done and the providers sign a note, it goes immediately back into the health system's database as a structured note. So huge improvement in quality as compared to these disintermediated systems. The third thing is the economics are better for the health system. They don't have to buy a new technology to use for telehealth or train their doctors or support a whole separate technology. They don't have to interface with a whole new technology. The Epic to Epic interoperability is built in already. There's some configuration, but no new interfaces have to be built, maintained, worried about, so much lower cost overall. And fourth and final is we have a fully functional EMR. What that means is we benefit from everything that's built in, from quality and decision support tools to a robust ecosystem, building other things that can sit on top of Epic, to the fact that it's so fully featured, we can put on a huge variety of virtualists. We're not limited to just urgent care or maybe some basic behavioral health. We can truly support primary care in an EMR that does everything, that has built-in things for remote patient monitoring and messaging and lab orders and so many other functionalities, from the analytics to a variety of things that allow us to really manage a population using the technology that's already been built and used by well over 60% of the health systems in America.
Okay, so this may be a very big oversimplification here, but what it sounds like to me then is that you guys are basically like a virtual hospital living on Epic the same way another hospital would be living on Epic, and you're working like hospital to hospital. Is that right?
Yeah, and health system to health system, right?
Health system to health
We're
system.
obviously focusing on the outpatient type of things right now, but that's exactly right. Just like any hospital out there may be a client of Epic and have their instance of Epic, we similarly now are putting our providers, just like a health system puts their providers on their instance of Epic. We put providers on our instance of Epic. The difference is our providers are all virtual. Our instance of Epic is optimized for virtual care. Think about it like you have Microsoft Word or Office, and depending on who and what you are, you're going to customize and optimize your version of Word to be appropriate for you, whether you're a blogger, a student, writer, etc. And similarly, Epic is a huge functionality of which a lot of places only use a portion of it, and we're focused on the part that really supports virtual care, which is, again, video, phone, asynchronous, remote patient monitoring. All of those functionalities are things we really focus on. We don't have to focus on what printer it's connected to and what office space it's in, and a variety of things that a office-based group does. We are what's called an asset light organization, so it allows us to really optimize in certain ways.
Okay, so this is the obvious question here for me. So why did Epic just do this themselves? Why have a KeyCare? Add it in there. I mean, taking a little bit more of Epic's piece of the pie. I mean, how does this all net out?
Well, that's like saying, why doesn't Epic open up its own hospital? That's not what they do. They are not a service provider. They don't want to be in that business. So they look at us, and we are a client, just like your Mayo and Cleveland Clinic and Northwestern and Stanford, et cetera, are all clients. They don't compete with their clients. We have a relationship as a client where we pay them for their software. So we're really part of the ecosystem. And again, what we're not doing is we're not creating or recreating software and technology they have already. We have 10,000 people in Verona, creating really great technology for us to use, both a base EMR, but also this telehealth functionality that they literally are updating on a very regular basis. And it is really meeting and improving anything I've seen out there in the standard telehealth world.
Tell me a little bit about the virtualists that you've assembled that are on this platform. So is that the secret sauce here for KeyCare, is that you've got these trained virtualists, these providers who are working remotely, keeping you guys asset light? I mean, tell me a little bit about how that factors into this. And then, by that same token, then what stops another health system from putting their docs on as virtualists and stealing away KeyCare clients in that way?
Yeah, so a couple of things. So first, think of us like sort of a two-sided network or marketplace. On one side, we have the health systems, and the health systems can and should use their doctors however they see fit. If they want them to be doing virtual care, they can and will do that. We expect them to. That's great. We don't come in and disturb that. We don't say to work on anything else. But what we also know is that's not the core of what a health system is. A health system is focused on taking care of the most complex, difficult patients. They do great stuff in taking care of cancer and heart disease and broken bones and really difficult patients and pregnant women, things that can be supported by low virtual care, but they really need that asset heavy in the office things. That's what they do that's special. And quite honestly, that's what makes them money, right? Doing virtual care is a very low margin business, usually a loss leader. It's not where they want their doctors. So they're working with us in part because they don't want their doctors doing a bunch of virtual care when they can make a lot more money and provide a lot more value to the patients in the offices. Meanwhile, we, being asset light and having doctors who really want to be virtualists, are able to be very efficient, very cost effective, and be able to make a profit out of doing that at high volume, particularly when we can spread it across multiple health systems. On the other side of this network or marketplace are all these interesting virtual care companies who've assembled virtualists, trained, educated them, vetted them, etc. So we're contracting with these companies to partner with us and sit and work on our instance so that we can make them more easily available to the health systems. So in many ways, we're actually opening up innovation to the health systems in a much easier way. Because today, if they want to work with all these companies, they'd have to contract with and technically integrate with 10, 15 different systems. It's not their forte. If they work with us, they don't have to do any integration. They can connect everything in Epic, and then they can work. They can essentially sort of choose what they want to turn on: urgent care, primary care, behavioral health, pregnancy and lactation support, specialized GI disorders, etc. We're finding all these interesting companies and contracting with them. And for urgent care, we've got a group of virtualists, there's physicians and NPs, who are able to provide this 24/7 50-state access, which is usually the first thing that health systems want. And then as we roll out other things, it will be in part in conjunction with the health systems and understanding what their real needs are and where and how we can support them in this team-based concept.
So really, this is like a very, very much a turnkey virtual care opportunity for a health system so that they can kind of extend their own footprint beyond the things that are their bread and butter within the four walls of their hospital. Yes,
right.
that's the sell for the health system.
It's the easy button for health
Okay.
systems to turn on a virtual care workforce to support them in a way that is truly connected but also economically makes sense for them versus trying to do it all themselves. It's very hard. Also, the reason we're not worried about them necessarily competing, right? Trying to set this all up. One, it's not the best use of their time and energy and money. And two, if you're a health system, do you want to work? Do you want a big medical center health system to start seeing your patients? Probably not. We really are an independent, neutral, Switzerland-like party. We don't have any office space. We don't compete with you. What we do is take off your desk, what I call the triple R threat that's drowning our doctors and providers: routine, repeatable, rules-based care. Stuff that is high volume, but low value, the bottom part of the population health pyramid. It has to get done. If your doctors are doing it, that means they're not able to take care of the mass of more complex patients they're trying to get in. They wind up then in the ER. The ERs back up. Patients wait. I mean, it's a horrible system that we've created. I am inspired, quite honestly, by everything outside of healthcare in many ways, right? Travel agencies, you don't go in. Remember when we were young, you had to go in and physically see someone. You don't do that anymore. If you have a really complex, you're doing a around the world trip, you might do that. You might actually go in and talk to someone. Think about banking and entertainment and commerce, right? I mean, what Amazon's done, in the commerce world, right? And we'll talk a minute because you'll probably ask why, what's going on with them in healthcare. But we also could look at healthcare. If you think about it, when's the last time you went to an eye doctor, dermatologist, et cetera? They've really embraced this team-based care. And what we're saying is, particularly for primary care and a lot of the cerebral specialties, that this idea of a virtual team-based approach is what starts to relieve the doctor, take some pressure off the doctor in the office, open up their access to the more complex care, expand the panel size that a single doctor or health system can manage. And for a health system, that's really important because panel size in a fee-for-service world creates downstream revenue, and a capitated value-based world increases the amount of revenue that you can get. It works for everyone because we believe in the power of health systems as compared to a lot of independent third parties out there doing niche care. It's nice, it's convenient, but when it's not integrated and connected, you risk, missing out on things that a health system can take care of. Just because you can deliver birth control pills overnight doesn't mean that you know how to take care of a pregnant woman, certainly not her complications. And so what if we could make all that one happy package so the health system can go out and tell all of their patients, whatever your needs are, come to us. We can take care of the most complex things, but we can also take care of that super simple, convenient stuff, because now we have a partner who can help do that in a way that's truly connected into our system.
I'm curious to dig in here a little bit more on that health system piece of this, and like really kind of this from a strategic standpoint, what you're hearing from these health systems that you're working with, or that you're angling for as clients, because I feel like we in virtual care and in telehealth and health, digital health, I mean, health tech in general, we've been super excited about the omni-channel care strategies that we've been talking about from the last 2 years, thanks to the pandemic, hearing that a lot of the big incumbents, whether it be a plan, whether it be a health system, or even a large self-insured employer, making some kind of investment in integrating in virtual care into the mix of the offerings that they have available, either to their members, employees, or patients. I want to know from you, Dr. Lyle, I mean, is this omni-channel care strategy really such a thing when you're talking to health systems and hospitals, or are they still kind of struggling to figure out how it fits in? And what you guys have here is something that kind of meets them along the way of figuring out how to even begin to turn on that other channel of care. I mean, tell me what you're hearing as far as how that goes, omni-channel. How's that playing out?
Yeah. So as a reminder, right, I'm a health system guy. I spent 20 plus years as a physician and executive at Northwestern Medicine in Chicago. So yeah, I really do think I understand and know what goes on in a health system.
You're
And
also the CMO of MDLive, so you're just as much a virtualist.
and on that side, so listen, this company wouldn't have started if not for the pandemic, right? Because all of a sudden it took everything I know from health system, being a virtualist, startups, etc., and Epic, right? Because I spent a lot of time working with Epic in various ways and brought it all together. And what I truly believe is that health systems, certainly they're smart people. They understand what's going on. Pre-pandemic, though, it wasn't their greatest interest or need because they were so busy. For people come in the office, they didn't really have to think about it. With the pandemic, they had to think about it. And as they say, genie's out of the bottle. Now we're seeing a decrease in virtual care at health systems. But why is that? It's not because patient demand is low. In fact, patient demand is as high as ever. There are multiple surveys. We did a survey that showed that when we asked people for routine care, whether it's urgent or chronic care, for the basic stuff, what would you prefer? And 30 something percent said, I still prefer an office visit. But 45% said, I prefer a virtual visit. And the rest, 20 something percent, said, I'll take whichever comes first. So what we're saying is the vast majority of people are willing, in many cases happy, to do a virtual visit for routine care. It's a lot of people. Health systems recognize this. What they're worried about is that if they don't do it, someone else will. And if someone else starts doing the easy stuff, well, that's just a pathway in leakage, as they call it, to start doing more and more things, and they start losing out on that first touch. So they recognize, they always have the importance of having a big funnel. It's why health systems buy primary care practices. Primary care practices do not make money in and of themselves, but every primary care physician represents about $2 million in value per year that they direct. And so that's why working with us, we're simply expanding their funnel so they're touching more patients. And the idea is that a health system doesn't want to see 1,000 basic sinus infections. What they care about is the 10 or 20 of those patients who will need a CAT scan, ENT surgery, need an elevation. And instead of spending their time and money on having their really smart doctors and offices seeing 1,000 sinus infections, why don't they just have us see them, and we will filter out and send in the ones that actually need escalated care. It's a win-win for the patients. They get quicker, easier access. For the health system, they get to see the patients that they really need and want to see. If those patients went somewhere else, they're probably not going to be identified as having a high risk. And even if they are, where are they going to go? The independent group is going to throw their hands up, say, go see a doctor. This way, you're really being able to touch the patient much more holistically.
As virtual care becomes more commonplace, and KeyCare lives up to all of this great potential and is providing virtual care to all of these different health systems across the country, does the role of the health system change? Because I mean, what I'm just hearing you say is it's almost like it's leaving the more complex patients, the more the things that really require physicians or surgeons or nurse practitioners or whoever to practice at the top of their license. That's what will be left for the hospital or the health system to deal with, where all of this like primary care, urgent care kind of stuff can be dealt with virtually. Is that where you see this all kind of heading? And as these technology trends start to really gain a foothold within, these healthcare provider organizations?
Yeah. So I'd suggest a transformation is needed on how you manage a population. And so, yes and no to what you said. Yes, in that absolutely we need to automate, delegate, virtualize much of this routine, repeatable, rules-based care out of the asset-heavy offices in a health system. And my argument here is that instead of letting those just be done by whatever independent third party is out there, and hope that they send them to the health system, that the progressive health system, it will partner with KeyCare. Let us do that, but they're not giving it up. What they're doing is just increasing their umbrella. The whole idea is that we are part of their team. We are representing a virtual workforce that is glommed onto them and that is part of the holistic care that they offer to their population, rather than us being this independent entity, because we share data, because we'll be able to send messages and orders and referrals, et cetera. We are really just extending their team. And what we're doing is trying to take their doctor and leverage that doctor, just like every other smart business out there has done. Think about lawyers and consultants and journalists and anyone else. You get up to the top of that pyramid and you oversee a team. You're head of that team, CEO of that team. Right now, the process we have where we insist that every health decision has to be done by a doctor in an office, and all too often that's what we say, is not a good use of resources. You mentioned top of license. We want to be able to give that physician, yes, a nurse, an MA, maybe a nurse practitioner, but offices are constrained. And you can only give them, so many people. What if we can give them a virtual team? So all of a sudden you have a doctor and 2 or 3 or 5 NPs and 10 nurses, et cetera. Imagine how many more people that they can take care of. And they're going to focus in the office on those people who really need to be in the office. So at the end of the day, the vision of the world I like to see for doctors and patients is that a doctor only has to see 10 patients in the office every day, but they really need to be there. He oversees a team that manages maybe 100 or 200 patients a day, but that's done virtually and with automation, maybe even longer. And they bubble up, they filter and they decide and they triage who needs a doctor, who violates the laws of healthcare that gets a doctor. If we do that, we solve a lot of problems. We improve access for the patient for what they want. Lightweight stuff online, bigger stuff in the office, or maybe it's a virtual visit, but with your doctor. For the complex folks, they know that they're going to be able to get in and get seen. We expand the economics of how much a doctor can make. We decrease the burnout by not making them stuff their schedule every day with lightweight stuff. And we are more preventative in nature, and we really start to see that we don't really have, I often say, you've heard me say it, we don't have a shortage of physicians in this country as much as we have a shortage of using them efficiently. If we give them a tech-enabled virtual care team, we really start to leverage these amazing, smart, passionate folks the way they should be used to take care of as many people as possible.
On that point of having a virtual team around a physician, can you explain how does this work with KeyCare today? As far as you guys, the care that you're providing, if you have a relationship within one of the health systems that you have as a client, because Spectrum is in there are some others, as a doctor, as you, Dr. Lyle, do you get to work with the same virtual care team via KeyCare over and over again? Or is it kind of like that, different provider based on who's available? How does that work in terms of the collaborative ability between the providers that are working for KeyCare and the providers that are working in the health systems for the home of wherever that patient came from?
Yeah. So it's a little different depending on specialty and the type. So for urgent care, you are in general, starting out, we're working with sort of a group of doctors. And so it's who's available. Mm-hmm. And what's important in that construct is that once they sign a note, the note goes back in the health system. In addition, an in-basket message will get sent directly to the PCP, notifying them that the patient was just seen, and they'll be able to see the full note, contact the patient if needed. And so that's a nice to have. It's not as connected, though, as when we move into primary care support, in which case we actually would have a provider who's sort of assigned to a health system, may even be assigned to a group of doctors. So that could be a much tighter relationship. We might similarly work with a specialist group like a cardiologist team at a health system, and we might have doctors or NPs who are in support of them. In those type of cases, I would see a much more collaborative approach. Whereas urgent care is on demand, who's available 24/7. We're going to also move into a much more closer relationship as we move into primary care support, where a primary care provider that we have might be doing, preventive care, wellness checks, care gap closures. They might be doing chronic care, follow up on the patient, remote patient monitoring. They may also do the urgent care. And when they're doing urgent care, you are going to have a closer relationship as well. So we see a nice evolution of how that's going to work. Similarly, when we think about behavioral health, we'd have therapists, psychiatrists who are going to be able to connect with both the primary care doctor as well as the behavioral health specialist in a health system. And so that really will unleash and unlock the potential of what we're trying to do.
All right, wrap up here for me and tell me what's ahead for KeyCare, the business then. Because like I said at the top, just closed out that Series A round after a nice little month lag there to add a few more dollars to the coffers there. So congratulations on that. You guys topped out at 27 million on that A closed. So what now? What do you guys, you said you're asset light, the technology's basically built by Epic, harnessed by you. You're contracting a lot of your providers. You're kind of acting as that middling instance for some of these virtual care companies that have supply of virtualists for the health systems that need them. So what gets built out here, Dr. Lyle, with that 27 million?
As my team hears me say, we're in a rocket ship that just took off. It is pure growth mode. We have been contacted by well over 25% of all the Epic sites out there.
Wow.
And there are a lot of them who are saying, how fast can we get on? So we are where we want to be. We have great product market fit. And so we have the type of growing pains you want as a startup, which is we have too much demand and we are trying to meet that. We are rolling out to a lot of health systems, and we expect this year to see major growth and execution on what we're trying to do. We certainly expect to roll out significantly more urgent care support across the nation. We've already, we know we've taken care of patients in almost 40 of the 50 states, and the volume is increasing quickly. But we also know that there are other demands out there. Behavioral health is, I would say, is going to be very close. We'll be rolling that out probably in the second quarter. Virtual care support in a variety of ways, as I mentioned, can be preventive care, chronic care, urgent care, workflow efficiencies. We have a number of different products that are going to be rolling out to support the primary care doctors in particular. Huge demand. And then we're also talking to a lot of these niche, interesting specialty companies about coming on our platform and being available to the health system. So we will announce those as they come out. I'd rather sort of wait until things are live. I don't like to overpromise at all.
Come on,
but it will be an exciting big growth year. And Jessica, yes, I promise you can hear quickly on these things. But it is, we are, like I said, trying to be the easy button for health systems. So assuming you make the decision that it makes sense to bring in some extra support for your workforce, you hit that easy button and turn us on. And once we're turned on for one thing, it just gets easier and easier to add more things on top.
All right. Well, Dr. Lyle, we'll have to have you back when some of these big reveals. All right, no, I'm serious. Well, you've given us a lot to think about here. And hey, one last thing for you, just in case anybody out there is concerned about this. Public health emergency ending. Does this put an end to the demand for certain aspects of telehealth in your mind? I mean, from what I'm hearing, generally no, but it's always good to check with my virtualist, former physician, still physician, health system KeyCare guy here. So what do you think?
Yeah. So first of all, demand is high no matter what. The issue is who's paying for it. So number one, the omnibus bill that was passed at the end of the year did extend a lot of the Medicare changes through the end of 2024, in which case we believe that Congress will hopefully finalize some of these rules. And that just is, allowing Medicare to pay for telehealth, et cetera, in which case a lot of commercials follow. There are a couple of things that we're going to lose, nothing particularly significant to us, things like, HIPAA waivers, et cetera. We're HIPAA compliant. We're not worrying about stuff like that. And a couple of things around, copay waivers, et cetera, but nothing that's going to significantly affect us. By guarantee, demand from patients is particularly high, but what's important is to understand that the health systems have officeologists, right? They don't have virtualists. They have doctors who love being in the office. They're incentivized more. It's an easier lifestyle. They want to get back to office-based care. And while demand goes up and supply goes down, that is where you see a market, and that's where we believe we're simply better than the current offerings of other third-party vendors. And as a result, we're, like I said, we're getting a lot of interest and a lot of implementations rolling out, and we hope by the end of the year to say, hey, we are working with well over a dozen systems, and we are significantly helping them transform, again, how they manage a population, because that mindset will involve cultural changes, physician comp redesign, to really fully capture everything we can do. Means that health systems will start shifting to this population health mentality, which everyone's been talking about for years. We just think we're part of the puzzle and executing on that. And that will be a really exciting discussion to have a year from now. But I certainly hope in a couple of months to be able to talk about new cool things that we're rolling out as well.
All right. Well, I look forward to having you back and hearing what other terminology you can invent. Officeologist? Did you just say
yes.
officeologist?
Yeah, so we have hospitalists, virtualists, officeologists. It all makes sense. Oh, and we'll be at ATA, Vive, HIMSS. So
right.
we're out there now.
With you. I'm going to continue to pester your officeologist. I mean, Dr. Lyle, I mean, your ability to create business models and also invent new words to describe the people and components of them is just second to none. It's always a pleasure to speak with you. Oh, gosh.
Appreciate it.
No problem. Well, we will check back in with Dr. Lyle, like we said, and all those other officeologists that he's trying to convert into virtualists, or at least augment them with the support of KeyCare. Thank you again for joining us. And for more interviews with the who's who of health tech as they are changing the way that we do healthcare, you can head on over to my YouTube channel. It is youtube.com/WTF Health. Hey, hit subscribe while you're there. I'd appreciate it. We'll talk to you guys real soon. Dr. Lyle, see you at ATA. Take care.
Thanks. Take care.